I'm Francine, and I had cataract surgery on my left eye. In a month, I'll have it on my right eye. 4 years ago, in my regular yearly checkups, I had my optometrist say I had cataracts and needed to be examined. And the ophthalmologist I saw had me scheduled for cataract surgery. And then when I went in for a pre-op exam, another ophthalmologist saw me. He says, "Oh, no, you can't have cataract surgery because of my RK. I had radial keratotomy about 15 years prior." He said because of the incisions on my cornea, that cataract surgery would not be successful, and I would need cornea transplant over time. Needless to say, that was very shocking and very frightening. So I was kind of on a search of trying to understand what my eye condition was. During the 4 years, every yearly checkup, I would have new prescriptions, stronger prescriptions. I had doctors for contacts. I could not wear glasses because the cornea and the RK was becoming, I don't have the medical terms, but it was becoming more difficult for me to see. And so contacts was the only way that they could improve my vision. I did need glasses because once my contacts came off, I was having a hard time seeing. And so I went to, I don't want to mention names or anything, but I went to an optometrist who specializes with people with difficult visions, and he was able to come up with some glasses for me. And he too said, be careful when you have your cataracts removed. Because of the RK, there could be complications. So I finally ended up having the surgery on my last yearly exam, my fourth. I always get them mixed up. Ophthalmologist that I've seen was ready to do cataract surgery and didn't even discuss my cornea with me. And that was frightening, that there was no communication with a doctor, especially considering what I've been told before. So I researched some more, got some recommendations, and heard about Dr. Boxer Wachler, that he was the doctor for doctors, and to come and get an opinion from him. And so I did, and he pretty much spoke the language that I had read about, the measurements, the tools for measuring, precision calculations. That was very, very important. And so he was using that terminology that I had somewhat understood as a lay person, and with his recommendation, I felt comfortable to proceed with the surgery. So I have the surgery. Needless to say, I was very, very nervous, hearing that I was going to need, cornea transplants. Cataract surgery would never be successful. I mean, I was going into the surgery with trepidation that I would come out maybe worse off visually than I was. And I am very pleased to say now, this is 2 weeks later, I can see distance very nicely. I can drive very comfortably. My left eye has healed, is healing as we had hoped. That minimal, if I'm understanding correct, that my RK incisions really are not interfering that much with the healing and process and the visual acuity that I'm going to get. So now I'm scheduled for my right eye, and look forward to having that done, because right now I'm quite lopsided. I can see far with one eye and really close up with the left eye. And I'm not as nervous now because the procedure was very comfortable. The anesthesiologist that I had was very comforting. The care I got was very attentive, and the follow-up care that I've gotten was regular, and I can't think of the word, but I've just gotten really thorough care up to this point, and I'm looking forward now to my next surgery and being able to see clearly and not miss some of the signs I was missing before that are important in getting through everyday life and enjoying life. Thank you.